Hey everyone, welcome to our presentation. We're so excited to have you tuning in with us today. Just want to start out by saying that I'm Macy Guerrero and I'm a sophomore.
I'm Vega and I'm a sophomore.
And I'm Alyson, I am a junior.
Florence Nightingale was once quoted saying, "Nurses work tirelessly to identify and protect the needs of the individual. Beyond the time-honored reputation for compassion and dedication lies a highly specialized profession which is constantly evolving to address the needs of society. From ensuring the most accurate diagnoses to the ongoing education of the public about critical health issues, nurses are indispensable in safeguarding public health."
A little more about what we think nursing is as a group. Nursing is the care and assistance of a sick or healthy individual in their recovery process. Nurses are dedicated to their patients' care and protect their needs as well as advocate on their behalf. They are selfless individuals with a passion for helping others and caring for their physical, mental, and spiritual needs. So some of the values that we think nurses should possess and do possess is caring. Caring, which often is considered to be synonymous with nursing, is a fundamental value for nurses both in their personal and professional lives. This is quoted by our book. The authors are Yost and Crawford, 2020. Caring can be defined as displaying kindness and concern for others. As nurses, we take the time with the suffering individual. We listen and advocate on their behalf and heal physically, mentally, and spiritually to demonstrate our care. Our textbook states on page 26 that many nurses' theories exist that identify the concept of caring as the primary focus. I couldn't agree more. Without caring, we lose our sense of purpose, drive, and passion for helping others. To value caring as a characteristic in nursing is to value your patient.
Another value that we believe is important in nursing is compassion. Compassion can be defined as
You got it?
compassion is the force that impels and empowers one to recognize, acknowledge, and act to alleviate human suffering. Compassion is a necessity as a nurse to be able to make your patient feel important and like you care. Without compassion, your patients may not feel like they can trust you, and trust is key.
And the last value that we have put down is selflessness, as selflessness is caring more for what other people need and want rather than what you yourself need and want. It is also going above and beyond for your patients and making sure that you're giving them the best care as possible.
A little bit more about our testimonies and like the reasons we want to be nurses kind of goes into a little bit of, some experiences, and here's mine. Growing up, I looked up to my mom, who's a nurse, and my sister, who just became an ER nurse. Well, not just, but she's an ER nurse. And I remember we had plenty of moments where we would be on outings together as a family, and someone needed, assistance medically, and my mom, she just jumped right in there without a second thought, jumped in. And I remember thinking, like, I want to do that. I want to be able to help people like she did. She has always inspired me, being a God-fearing, selfless woman she is. And after that experience, I just got this gut feeling that God was calling me to be a nurse and to pursue this profession. She's been diagnosed with brain cancer, and at one point she had a seizure, and I remember just feeling so helpless because I couldn't do anything to help. I didn't know what to do. With training in nursing school, I hope to be able to step into those situations and help anyone who's in need. I know this is kind of silly, but I used to watch these Facebook videos, and there would be like shaking baby syndrome and just, NICU babies, and the hospital that these babies were at, they'd have a board where if they were grown up, and they'd pose with the nurses, and they'd have just a board of all of them grown up. And I just remember getting so teary-eyed and just thinking that's what I want to do. I want to be able to impact someone's life like that.
A little about my experience and why I chose nursing was that the main reason why I chose nursing was my baby sister, Gracie. She was born 3 months premature, and spent the entire first month of her life in an incubator because she was so little that she didn't fit in baby doll diapers, and you could see through her skin because she was so underdeveloped. But we were lucky that we had some family who worked at the hospital that she was at, so we knew she was receiving great care. The nurses who were taking care of her provided the necessary care she needed to be able to survive, and that inspired me to go into the same field.
So with my testimony, I feel like God has called me into nursing, as I have had the opportunity to get hands-on experience training in a hospital as a patient care technician, and I got to go throughout the levels of the hospital and see what it was like to work as a patient care technician on the floor and getting hands-on with patients, being able to communicate and talk to them and making them feel like they're receiving the best care possible. Another thing that has led me into wanting to go into the nursing field is my grandfather. When I was in first grade, my grandfather, he had bladder cancer and type 2 diabetes. During this time, I was able to provide care to him by, I had a clipboard that I'd carry around with me with the paper and a marker, and I also would give him medication, which the medication I gave him was Runts candy. I know it's silly. And then I also was able to check his blood pressure with the blood pressure machine that they had at the time, getting to put it on his arm and pressing the button to turn it on. And it's very exciting because I was like, oh, I can take care of him and do this on my own, even though there's other adults with me at the time. Another reason why I wanted to go into nursing was because of my sister. At age 12, my sister was diagnosed with type 1 diabetes. It was a very scary moment for us, as she was near death during this time. If she would not have been taken in sooner, she could have died. When she was diagnosed, I could tell you all the little details as to what had happened. It was crazy. She got so white in the face. Her tongue was extremely white, and she was vomiting a lot, which of course in return, made me vomit because I saw it and I smelt it, and it triggered my brain. I don't know, but it was a very interesting experience. Later on, throughout her diabetes, she started having seizures, and it was very, very late at night. Her best friend was over at the house with us, and she lost complete control of her body during this time. When we had taken her to the hospital, she was then diagnosed with Graves' disease, which is an overproduction of your hyperthyroid, overproduction of your thyroid, which is hyperthyroidism. And then lastly, the reason why I wanted to go into nursing is because my dad, he was recently diagnosed with Ehlers-Danlos disease, which is it's a connective tissue disease that causes formation in your tissues. For him, this has affected mainly his abdominal area. So with this disease, he has had a lot of hernias, and recently just had his 9th hernia surgery due to this disease. There is no cure for it, but they can treat the symptoms for it as well. This has made me want to go into nursing because I want to know why that's causing it to happen and why there isn't a way to stop going, why there's not a way to stop the hernias from forming in his body.
So not only do we have our testimonies of why we want to go into nursing, but we also have our reasons, and one of our main reasons is to impact others' lives. In terms of helping people individually, one key influence can be being told something by someone we trust and respect, and nurses, as one of the most trusted and respected professions in this country, can and do make a real impact. Bennett, 2017. So a little bit about how I want to make an impact. One, I want to impact care and change lives. It's as simple as bringing a smile to a patient's face after a hard day. I want to be a nurse so that I can show the love of God through the best care I can possibly give. And I've always had this servant's heart, and what a better way to serve others than in their time of need. It started with a passion to help people, and wherever God leads me is where I'm supposed to make an impact.
My goal for the impact that I will make is for my work to be remembered. My name doesn't need to be remembered, but I would like my work to be remembered because I want to be able to give parents the same joy the nurses who cared for my sister gave mine when they saved her and helped her get on the right track to being a perfectly healthy child that she is now.
So for me, what I want to do to impact nursing is to help change the way patient care is given. To help the patients feel seen, heard, and cared for. As in a recent experience with my sister, she had just given birth to my niece and in the hospital, and the nurse that was taking care of her was not taking the time to listen to what she was saying and paying attention to her needs, like not just physically and emotionally and taking care of her symptoms, but being there for her. She was completely ignoring my sister's needs. The nurse I had caught out in the hallway talking poorly of my sister, and of course it made me angry because she didn't take the time to find out why my sister was in pain and why she was not communicating with her about her pain. This is why I want to help change the way patient care is being given.
And lastly, we have our reference page, of course, where we referenced articles and our textbook. We want to thank you for attending and tuning into our presentation. We hope you're inspired. We hope you go out and you change the world. Thanks for watching.